September 2020 is also known as Urology Health Month. In this short video, I'm going to talk about one of these topics that is near and dear to my heart, and that is vasectomies. So if you have any questions, please feel free to leave them in the comments below. Either if you're watching it live or on the replay, I'd be happy to answer them for you. But let me just go over some of these questions that you may have, and maybe some of the questions that you may have will be answered in this short Q&A session. For those of you who don't know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also known as the Experminator, being the #1 vasectomist in Gilbert, Arizona in the East Valley. As a matter of fact, as far as I know, there's no one who does more vasectomies annually than I do. Last year alone, I performed nearly 1,000 vasectomies right here at Sunrise Urology. A lot of guys ask me the same questions over and over, and I've kind of collated a lot of them and I put them on Sunrise Urology's website. If you go to sunriseurology.com, you'll be greeted with this page. Now, if you go over to the section where it says conditions treated and scroll all the way down to the bottom, these are listed in alphabetical order. Click on vasectomy, and you'll be able to see videos and some of these questions that guys typically ask. First of all, I performed this procedure without using a scalpel. It is done right here in the office, no scalpels involved, and it takes about 10 minutes. It also does not require 2 different openings in the scrotum. I do everything through one tiny little puncture. Procedure is done here in the office, takes about 10 minutes. The patient's typically awake. And the man doesn't care so much about what's going on because he is using laughing gas. And if you scroll down to this page right here and go right here, you can click on this link and hear one particular patient who had laughing gas here at Sunrise Urology. After his laughing gas and vasectomy, he gives a nice review of his experience. All right. In addition to laughing gas, I also administer lidocaine, which is numbing medication. So the skin is numbed. The guy is using laughing gas that he has full control over the gas. So it's not being forced on the man. And he's simply breathing through a tube. If he feels like he's getting too much gas, he simply removes the tube himself and he can breathe room air and he's back to normal within seconds. In addition, it is very important for the man to remember that vasectomy is a permanent sterilization procedure, meaning you should not think about having this done if you're not 100% sure that you are completely done having kids. After a vasectomy, a lot of men may think, okay, great, I'm done. I can start having unprotected sexual activity. Nothing could be further from the truth because you have to wait, clear the pipes, and have a semen analysis done about 3 months. We recommend 3 months and 30 ejaculations later before you have that first semen analysis. Because the longer you wait, the greater the chances of that one sample done after 3 months will show no sperm. But it's okay if it shows sperm. You will simply have to provide another sample, take another test, and continue to use pregnancy precautions. So you are not yet sterile until that sample shows no sperm. Another very common question a guy asks is, what happens to my semen? Does anything change with the stuff that I produce after vasectomy? The short answer is no, nothing changes. Even the quality, the quantity remains the same. The only difference is there'll be no sperm after a successful vasectomy in your semen. So nothing changes. A lot of guys are worried about sexual function, meaning they're worried about testosterone, whether or not that after a vasectomy they are going to have less testosterone, feeling less like a man. Well, the answer is nothing changes in your testosterone after a vasectomy. Keep in mind that when I perform a vasectomy, I'm interrupting nothing but just the flow of sperm coming out of the testicles. The hormones being produced by the testicles are still being produced and still being carried away through the bloodstream. That is not interrupted with a vasectomy. So rest assured, semen quality is the same, testosterone is the same, you're still going to be a man, you're still going to have your deep, low voice, so nothing changes when it comes to that regard. In addition, a lot of guys have asked me, after I have my vasectomy, will I need to come back to have sutures removed? Well, the way we do it, I don't need to remove any sutures. There are no sutures to remove after a vasectomy. You simply go home, relax, and recover. Typically, if you're working a desk job, or if you're during the current public health emergency working from home, you can pretty much resume your desk job right away if you're working from home, because nobody's going to know that you have an ice pack down in your scrotum when you're on a video, right? On a Zoom call or something like that. So for my guys who are having vasectomies now, I tell these guys, you know what? You can get right back to work the following day. Just put ice on the scrotum, wear tight underwear, and take it easy. If you're back working and not working from home, then we ask our patients to kind of take it easy for about 36 hours, 48 at the very most. And then if you're working a desk job, you can easily go back to work without any problems. For my construction workers, police officers, firefighters, those who have to use a lot of physical activity at work, I recommend that these guys take about 3 to 4 days off to make sure they have a smooth recovery after the vasectomy. Okay. What else? Some guys have asked, well, is there any change in my urination after my vasectomy? And the answer is no, because I'm not messing around with your urinary tube. I'm messing around with the tubes that conduct sperm. So nothing changes with your urination. Lastly, I'm going to go over something that some guys have mentioned, asked me about. They see a picture of these 2 testicles attached to these 2 tubes coming up. And the picture simply shows interruption in the flow of the tube. And the pictures are very cartoonish, and they don't show that everything else that is attached to the scrotum to the testicle. So they think that interrupting the vas deferens makes the testicles sag or change the way they lie or something like that. No, nothing changes in the way they hang. Nothing changes in the way they feel, the way they look. Unless you're a urologist, you probably wouldn't be able to feel where the actual vasectomy took place. You will not be able to see the tiny little single puncture on the scrotum after you heal from your vasectomy. So it's very quick recovery with one tiny little 3 millimeter opening on the skin, and through that one opening, I can perform vasectomy on both sides. Some urologists, now everybody does vasectomies a little bit differently. The way I do it is I want to do it so that I can sleep best at night, not having to worry about the tubes reconnecting as much as someone who may take shortcuts. The way I perform vasectomies is I do 4 things on each side to make sure they don't reconnect. I remove a small piece of the tubing. So imagine here's the vas deferens. I remove a small piece of the tubing. Now you are left with 2 open ends, right? Some urologists will simply close one end or tie off one end or clip one end with a titanium clip. I do not use any hard metal in your scrotum. I do not use any titanium clips. I will burn or cauterize both of these ends that are now open. I will tie off both ends, and I will cover up one end with your own tissue called fascial interposition. So I'm doing 4 things. I'm removing a small piece of the tubing, burning both ends, tying both ends, and covering one end with your own tissue. So as far as having the tubes reconnect after one of my vasectomies, it's going to be very, very unlikely. So, all right. That's it for vasectomies. If you have any questions, feel free to leave them in the comments, and I'll be happy to answer them for you. It is very important to call for your vasectomy appointment sooner than later. Towards the end of the year, every single year, there's a rush. And if you don't make your appointment now and book your vasectomy appointment, it is very unlikely, or it is very common and very likely that you will not be able to get the dates that you want. And sometimes you may not be able to have the vasectomy done before the end of the year because there's always a rush. All right. Any questions, comments? Leave them below. I look forward to seeing everyone. Take care. Bye-bye.